All right, please allow me to introduce the speakers for today. Member of the Central Steering Group in Hubei, member of the leading party member group of the NHC, the Secretary of the leading party members group of the TCM, Madam Yu Yanhong, and Mr. Zhang Boli, academician with the Chinese Academy of Engineering, president of Tianjin University of TCM, Mr. Huang Luqi, academician with the Chinese Academy of Engineering, and Mr. Liu Qingquan, president of Beijing Hospital of TCM, and Mr. Qiu Haibo, vice president of Zhongda Hospital, Southeastern University. First, give the floor to Madame Yu. Friends from the media, good afternoon. This is my third time to join you here in the press conference held by the State Council. In the previous two press conferences, I have introduced the work and role played by the traditional Chinese medicine. I would like to take this opportunity to thank all the journalists for your coverage and acknowledge you give us a great encourage in our work. With the different development stage of the pandemic, the experience got by the TCM in China would like to play its bigger role in the global stage. I believe everyone also would like to know how the TCM can exert its role in a larger landscape. Therefore, under this circumstance, with all the guests here, we would like to conduct more discussion and exchange to share with you the role of a TCM in participating in treating the patient. General Secretary Xi Jinping attached great importance in the pandemic control, and he personally has led and command the pandemic work, and also emphasized many times the combination of the TCM and Western medicine. Under the leadership of the CPC Central Committee, the arrangement made by the Central Steering Group, as well as the Premier Li Keqiang and the comrade of the senior member, the Vice Premier Sun Chulan, the Central Steering Team had the emphasis a lot on the involvement of TCM in treating patients, and I would like to give you some introduction in the following areas. First, we have mobilized the team across China, more than 4,900 TCM physicians to support Hubei province, taking up 13% of the total assistant medics, 3 academicians, and more than hundreds of the experts involved. Given the size of the team and the forces mobilized across China has unseen before. Second, we also conducted classified treatment. The early involvement and application of TCM happened to the treatment to the mild cases as well as the recovery patients, and we also have the diagnosis and treatment plans involved TCM and also released. At the early stage in Hubei, many patients actually waiting in the quarantine areas for their confirmed results. We gave them the ready-made TCM to effectively release the burden on the medical service as well as their symptoms. And third, we have find the effective medicines, and in the 5th, 6th, and 7th diagnosis and treatment plan, the prescriptions and the ready-made TCM also involve the clinical trials. So far, we have got 金花清感、莲花清瘟 brittles, 雪碧净 injections, the lung cleansing and detoxifying decoctions, the 化石败毒 formula, as well as 宣肺败毒 granules. All the 3 prescriptions and the 3 formulas actually play a key role to showcase its efficacy on treating COVID-19 patients, and also creating a highlight in the epidemic prevention and control effort. 74,787 patients taken TCM, taking up 91.5%. Number in Hubei is more than 61,000, taking up 90.6% of the total number of people. Based on the clinical manifestation, more than 90% of the patients showed better symptoms, and it can effectively relieve their symptoms and also blocking the way from the worsening and increase the cure rate as well as lower the mortality rate, and also can help people in their recovery stage to gain a better immune system. During the work this time, the TCM physicians rushed to the front line, showcase their spirit and also forge ahead and putting aside the risks and contributing our strengths from the TCM side. The TCM represents long history of the time-honored approach in China to tackling disease, and this is a treasure trove in the Chinese history, and you always can find the solutions and the presence of a TCM in any infectious disease. We talk about the Zhang Zhongjin. That's the well-known physicians, and also the jade spring powder, and also the other well-known prescriptions, all actually got the fundamentals, clinical practice, formulas, and techniques from the ancient history. These actually the priceless assets for us based on the our predecessors' arsenals. And to you actually also shows another example that by using the TCM to cure the malaria, and also got the Nobel Prize. To treat the contagious diseases, TCM also has its advantages in this regard. Regarding the frequent outbreak of the respiratory disease such as SARS, H1N1 pandemic, TCM will play its role in this regard to treat patients. For this front, the TCM also got its experience accumulated in this regard, and it also shows that TCM can help people to increase their body immune system and inhibit the disease. Friends from the media, the onset of disease actually happened to the absence of the effective drugs and vaccines. Therefore, we need to find out the nature of the disease and also get the reference from our classic prescriptions and formulas, and we also have the diagnosis and treatment plan based on the advantages of TCM and Western medicines. Therefore, we have come up with these 3 prescriptions and 3 drugs of TCM. The practice once again showcase that TCM, a treasure trove from our predecessors, should be cherished by everyone because it still works this time even under today's circumstance. Virus respects no border. We face the same enemy. All these valuable experience we accumulated through the long history, we would like to share with everyone to use as the General Director, the Dr. Tandros from the WHO. The turning point got by China showcase that their way to treat and contain the COVID-19 are effective It's good to learn from other countries. Therefore, I would like to utilize this platform through all the friends from the media that China is ready to strengthen our cooperation and exchange with other countries and also share our experience in terms of treatment and disease containment. And also would like to provide the effective ready-made TCM and the consultant service by our experts to countries that need it. Thank you very much, Madam Yu. Now the floor is open. And the same as previous times, so we will open the floor and please ask questions through the video link. And also please identify your media affiliation before asking questions. CMG CGTN. TCM actually had a key role in the process of the containment. And my question to Mr. Zhang, any experience or license you would like to share with the international community? I arrived in Wuhan on January 27th. Right now it's almost 2 months. When I arrived here, the hospital were overwhelmed. More than hundreds of people waiting in the line in fever clinic. They waited for hours and couldn't get access to the medical service. And also, actually, you can see all the people massed together. You couldn't tell who were the patients, who were their family members. After 2 months, what we have here, the current situation in Wuhan, right now we have the 5,000 patients from 60,000. And also we have the more than 5 consecutive days to achieve 3 zeros in terms of the confirmed cases, suspected cases, and the new confirmed cases. We talk about, we right now see a bright stars shining in the sky by breaking through the dark night. We know right now everyone quite concerned about the pandemic, especially the hard-hit regions such as Italy. Therefore, we are ready to share with you. So at the very beginning, based on the mass situation in Wuhan, the central steering team in Hubei conducted the classified method, which is a 4 category of people in terms of identifying and quarantining the people with fever and confirmed suspected patients as well as close contacts. And also the people in Wuhan showcase their capabilities that they only use 2 to 3 days to separate all these 4 category people, but without effective drugs or vaccines. We only made half of the whole journey, but what we had, TCM. Therefore, we gave the ready-made TCM to the patients. At the very beginning, it's not that smooth. At the first day, we only gave out 3,000 bags of TCM. After 2 to 3 days, people started to see the symptoms such as a fever, cough actually relieved. Therefore, more and more patients ask for TCM. So far, we gave out more than 600,000 bags of the TCM. So what's the role? Actually, it helped to improve the symptoms. We talk about these 4 categories of patients. The confirmed cases took up 80%. So after taking the TCM, this number dropped to 30%. By the end of February, this dropped to single digit. Therefore, we talk about the centralized quarantine and with the medication of TCM actually laid solid foundation for us to win the battle against COVID-19 pandemic. We talk about we should bring all patients to the hospitals for treatment, but actually at that time, we face a severe shortage of beds. Therefore, we take it a scientific and targeted measures. For critically ill patients, they would receive the treatment in the designated hospital, and for the makeshift hospitals are designated or designed for the mild symptom patients. Therefore, we had a makeshift hospitals with the standard and a process, but still makeshift hospital actually was renovated from the other facilities. And a large number of patients actually all lived in the makeshift hospitals. We need to think about how to better manage all these patients. Therefore, we made suggestions and to better manage the makeshift hospital with TCM medicine. And we also have the one makeshift hospital, the Jiangxia Hospital, that's with only TCM medicine. And we talk about that we should give the hot water, the warm, the meals, as well as the care to the patients. All in all, that we should bring that warmth to the patients. We help them to organize the activities. You can see actually they did exercise together, and you can see actually these very good chemicals going on in the makeshift hospital. It was not a hospital actually. The patients felt that it's just a community, which is also conducive to treat the patients with COVID-19. As we know, the mild symptom patients actually were stationed in the makeshift hospitals. According to WHO, 13% of these patients worsened to severe, and 7% of them developed to critical conditions. So we talk about how we can better prevent from worsening. This is our target. That is why we brought the powerful combo. Besides the ready-made TCM remedy, we also had the other orthodox therapies such as the acupuncture, massage, and other exercise. Take Jiangxia Makeshift Hospital, for example, 654 patients, no one worsened symptoms. And for other hospitals totaled, only 2% to 5% of the patients in all makeshift hospitals worsened their symptoms. But all in all, that this number actually was much lower than the number released by WHO. This is also a good progress we made. And especially we focus more on the treatment of the critically ill patients. We would like to let the Western medicine to take the dominant role, and TCM will be more for a supporting role. We talk about in the Liangshan Hospital, the hospital of the TCM and Western medicine, as well as the pulmonary hospitals, the TCM all involved in ICUs. And also we bold to take early stage involvement in the injections of TCM. And these help to improve the blood oxygen saturation. And the 谭热精 and 热毒宁 injections actually can work together with antiviral injections. 血必净 also actually play a key role in the inhibiting the cytokine storm, as well as to prevent the embolism. Everything we did there actually is want to lower the mortality rate. We talk about later on the patients released with their negative results to the nucleic acid test, but they still have some the symptoms such as the fatigue, the not have the quite heat, full energy, and actually the lung function, their immune system need more time to recover. That is why we also give them some TCM, the therapy, and also the medicines, which can largely help to relieve the symptoms such as the lung, the inflammatory improvement, as well as the other organ functions recovered. Therefore, the combined treatment also play a key role in the convalescent stage for the patients. So we talk about actually look at the whole curve of the COVID-19. The TCM play a larger role at the starting point and the ending point. We have effective formulas. And also the highlight of the Chinese approach was this powerful combo. When I look at the pandemic, actually is also developing so fast. And TCM showed a boundless love, and we really like to share with the practitioners across the world. Thank you. Reuters. The high-level experts, Mr. Du Bin, mentioned that the TCM maybe could use the Western system, Western medicine system to verify the effectiveness or the efficacy of the TCM curative effect and what we can do in this regard. I give the question to Mr. Chu Haibo. I knew Dr. Dubin, we are the colleagues, and we also worked together to treat the severe and critically ill patients. We had a lot of discussions going on regarding the treatment plans, diagnosis, as well as the combined treatment of TCM and Western medicine. The ICU doctor, how to evaluate the curative effect of TCM. We actually adopted the international practice to evaluate the efficacy. We look at the ready-made TCM, the TCM injections. Actually, also use the RCT to evaluate the efficacy of TCM. As we know, at the academician Wang Chen and Gao Lin had conducted very strict controlled clinical trials on Lianhua Qinggan capsule and Qili capsules, their effectiveness on H1N1, and also the chronic congestive heart failures, and they based on the sample of 400 to 500. And also compared to the normal treatment and the normal treatment plus TCM, and we can see that Lianhua Qinggan capsule and obviously shorten the time of fever. Qili Qiangxin capsule also effectively improve the heart function. And we also have the paper release on the international journals. And we also emphasize the 血必净 injections. And the academicians here, they also have some clinical studies in this regard by adopting the international practice to evaluate the efficacy of TCM. A traditional TCM actually emphasizes a lot on the individual treatment, which means that we should identify the syndrome and disease of each patient. And we also actually right now also evaluate the TCM efficacy based on the methods on testing syndrome differentiation. This time, we actually involved at a very early stage of TCM to treat the patient with severe and critical conditions. So far, we can see based on the clinical manifestations, we have seen some improvements. First, it helps reduce the possibility of mild infections becoming more severe. And second, it also reduces the possibility of severe infections becoming critical, and also can treat the patients in the severe and critical condition, and also help to do the recovery work for the patient. So TCM actually play a key role in the above mentioned areas, and we also have seen a good curative effects on preventing the symptoms from worsening, and also play a very key role, especially in the rehabilitation period. I'm with a Western medicine background, so we talk about the treatment or diagnosis actually quite different compared to TCM and Western medicine. So look at the Western medicine actually is focused on the single target. However, TCM actually focus on more targets, which means TCM is more like a teamwork. Therefore, the model of treatment between these two are totally different. But if we look at the whole development and mechanism of a disease, some the milestones actually you can take intervention. We talk about the COVID-19 this time, and that actually impact the immune system because of the inflammation, and also later on trigger the other organ failures. So we talk about immune system, the organ failure, all could be considered as targets. So Western medicines or the chemical medicines actually for certain single target along the journey. But TCM actually can focus on the multiple targets. We talk about the replication of virus. We talk about the improving the immune system, the coagulation. The all can be treated as the multiple targets by TCM. Let's take the 血必精 injection for example. This is quite the much studied the injections. So this is by the institutions in Shanghai, and we talk about at least 6 to 7 ingredients were approved effective, and also in vitro experiment has approved that 血必精 injection actually inhibit the replication of virus of COVID-19. And also based on our study on animals, we also found that it also helped to treat or prevent the excess coagulation and the formation of a thrombus, as well as to prevent the cytokine storm. That is why this time for treating critically ill patients, this time we involved 血必精 injection. And based on our previous clinical trial, it's already showed that 血必精 injection had a certain efficacy on pneumonia disease. We talk about so far there were no magic drugs to treat COVID-19 patients. We talk about whether 血必精 injections for sure worked to kill COVID-19. Regarding the severe pneumonia patients, as well as the patients with sepsis, actually 血必精 showed a good results in these two regards. Professor Bai Chunxue actually involved 32 hospitals, so they conducted a comparison between the 血必精and the Plato. So showcase that the 血必精 actually can lower the mortality rate by 8.8. The inflammation can be shortened, and also can shorten the period relying on the oxygen inhalation and also discharge. 血必精 also showcase that it can help to lower the mortality rate caused by sepsis. Because our experience study on the sepsis and the patients with severe pneumonia, that is why this time we would like to see the 血必精worked as well this time on COVID-19 as a multi-targeted drugs or the injections. We also conducted the cohort studies, involved 32 hospitals with 156 patients. It showed that based on the basic treatment plus 水倍镜, and it showed a better effect, and we will sum up the final results after the whole trial finish. But we can tell that 水倍镜 injection may be an effective candidate to treat patients with COVID-19. I believe everyone also concerned about safety. After the commercialized of 水倍镜 injection, we have also noticed that the side effect will not higher than 0.1% compared to the side effect found the clinical trials. So as the multi-target method or the medications plus the traditional treatment, we will for sure to treat more patients and save the life of patients with severe and critical condition. Thank you. Xinhua News Agency, these are the current results. So what are the most effective TCM to treat TCM patients, and how you evaluate the efficacy? Thank you for your question. So you will not be panic if you have something called drugs on hand. So every disease or every epidemic actually always can produce a good effect. That is also, we have a sentence there is like every pandemic or epidemic outbreak produce good prescription. And at the very beginning of COVID-19, there were no effective drugs. Like the Western medicine physicians, we work on the prescriptions and the formulas from our predecessors. That is why we come up with 3 prescriptions and 3 medicines. I would like to focus on the 莲花清瘟 brittle and the 金花清感 granule. For the 金花清感 granule actually was researched and introduced for dealing with H1N1 2009 influenza pandemic. Actually, this is a combination of 2 classic prescriptions before in the history. Actually, that's around 1,800 history. For one prescription, another with 300. So with the test of time, these 2 classic prescriptions show that they have good effects, especially in cleaning, heat, and detoxifying lungs. Academy of Mountain conducted a RCT and also released a paper in the American Journal. And it had a good results and less side effects, lower costs to treat influenza A patients. This time on the front line in Wuhan, we also conducted a clinical controlled trial of 102 patients. 莲花清感, especially for the patients, mild and moderate patients, compared to the control group, the 2/3 of the patients showed the improve of the symptoms, and also look at the improve the recovery rate of lymphocyte and white blood cells. And it showcased that the efficacy of 莲花清感 granule were confirmed. So they help to improve the indicators. And UN Hospital in Beijing also conducted a research involving 80 patients. We look at the turning negative days shortened 2.5 days. Also 2 to 3 days shorten of a time with clinical symptoms, as well as improving the number of lymphocytes as well as the blood white cells. Second medicine is 莲花清瘟 capsule. And this is also a result from SARS. It also relieve the fever, cough, and fatigue, reduce the occurrence of a deterioration of the mouth and the normal symptoms. And we already donate more than 100,000 boxes of this medicine to Italy, and I heard the updated information they also would like to have additional 100,000 boxes of 莲花清瘟 capsule to Italy. Academician Zhu Nanshan, Li Lanjun, and I involved the RCT had a really restrict design, 284 patients with COVID-19. And results showed that a percentage of the time with clinical symptoms and the better than the controlled team. The CT scan also improved at 83.3%. The compared group 61.4%. A cure rate 78.9% compared to 66.2% of a controlled team. Regarding lowering the worsening to the severe cases, it showed double improvement than the control group. And also the in vitro experience showed that the 莲花清瘟 capsule had an inhibitory effect on coronavirus. So we talk about the patients with the headache but light fever, we use 莲花金花清感. The 莲花清瘟is for the patients with the constipation. NBC News. Thank you for your question. I'm not worried. I give you the reason from my experience as well as the actual practice. The TCM and Western medicine actually come from different side of science, and they have different angles to diagnose disease, but all actually based on the clinical results as well as clinical efficacy. Therefore, in the opening speech given by Madame Yu, said to Yu, and along with the other physicians actually found the effective medicine TCM to treat the malaria. That is why helped the A2U to got the Nobel Prize. So we talk about right now more than 183 countries and regions welcome the TCM. According to WHO, 103 members actually recognize and would like to use TCM. That is why the International Health Conference, also in their 11th edition of the treatment plan, included the TCM. I believe because of the curative effective from the clinical practice, we introduced at this time the 3 TCM drugs, and the 3 formulas all had the curative effective. So I'd like to give you more information. First is about the 清肺排毒. Actually, that's the a lung cleansing and the detoxifying decoctions. This is actually derived from the several classic recipes in a traditional TCM book. Besides the Hubei province, the 10 provinces and 66 diagnoses hospitals with 1,664 confirmed patients or used these decoctions, among which 1,224 patients discharged, taking up 96.1%, and also compared to the combined method to the clinical yield patients. 42 patients were cured, taking up 73.7%. No case were worsened to a critical condition based on the CT scan results. So they took 2 courses of the decoctions. 93% of patients showed the good results in their CT scan. So the lung cleansing and detoxifying decoctions also have play a key role. It's mainly effective in improving symptoms and also help to lower the fatality rate and also lower the contagious. Another is 宣肺败毒 renews, and this is also based on the classic therapies. In Wuhan TCM hospitals, Wuhan Hospital of TCM and Western medicines, we also have the 70 cases compared to 50 cases comparison. 宣肺败毒 actually also effectively to increase the lymphocyte compared to the control group. The lymphocyte recovery rate improved by 17%. The cure rate improved 22%. Henan TCM Medicine, the first affiliated hospital to treat mild and normal conditions, patients 40. The turning negative days 9.66 days and no one worsening. CT scan also reached 85% of turning better results. And Hubei, Jiangxia Fangcang, the makeshift hospital, and to treat 500 cohort studies, the mild and the symptoms that they have the good results in the curing the cough, fever, and fatigue, and also CT scan showed better results and no cases from worsening symptoms. Another one is 化湿败毒 formula. So this is actually the modified by the team from the Chinese Academy of Medical Science, and also did this work in Jintan Hospital and in the makeshift hospital Jiangjilu Community Center conducted the clinical trial. In Jintan Hospital, the controlled comparison, 5 patients with critical condition, the CT scan and the improvement of clinical symptoms all showed good results. The turning negative days and the discharge days shortened 3 days on average. Jiangjilu, the community clinic, 124 patients. Dongxihu, the makeshift hospital, 894 patients with mild symptoms. 化湿败毒 formula applied to 452 patients to show its effective curative effect. We also look at the lung and the kidney functions. We show there's no adverse effect to the formula. And also we look at the genopics that also the 化湿败毒 also effectively to lower the lung viral load by 30%. That is also the 化湿败毒 formula approved by the national FDA. I would like to say that the TCM is different compared with the chemical or the Western medicines. But we all look at its clinical manifestation improvement. And we also actually conducted the RCT and other comparisons, and also would like to show you more quantitative results, plus clinical trials results to show the effectiveness of the TCM. Many countries also would like to use TCM, so the 幻视败毒 granules called Q14. So CURE means cure. That's also the name included. And 14 because it's involved 14 herbal components. So this is the cure 14. One for all for one. That's also the meaning embodied in the name. Therefore, we would like to shoulder with people around the world to win the battle against COVID-19 and share the results and treatment of TCM. 金香 news are okay. We talk about the MERS, SARS, TCMO included as the treatment plan. So is it different this time for COVID-19 compared to SARS? So is there any change? If yes, why it changed? Thank you for your question. As Madame Yu, Academician Zhang, and Liu actually answered more or less your questions. Regarding the treating infectious disease, TCM has more than thousands of the history, and we also got the quite good experience in this regard. We focus on focusing on detoxification and also the clearing the heat and the getting rid of the dampness. Based on different kinds of infectious disease, we will actually give different formulas, and we also have many classic recipes in our rich histories. So the previous speakers already introduced to you. We talk about the 张仲景麻杏湿干 soup, 孙思邈千金伟净 the formula, and also the 吴又可 the 大又饮. This is for the respiratory disease, and we actually got the all the experience and help us to understand how to better improve the body immune system and to dissipate the dampness and cold evil. So in the old days, actually, this helped to save the soldiers, and also we talk about the dissipate dampness. Actually, this helps to keep up the morale of the soldiers. We talk about actually the immune system actually involve two things. This will help us to actually increase your positive qi in your body to fight against your enemy. So basically for the TCM, we talk about you should have enough positive qi to help you to win the battle against the enemy, which is such as the dampness evil or the cold evil. So we talk about this should be improve your immune system. Let's let your enemy no place to hide. So this is basically a war happened in your body. In the previous 2 decades, China had introduced some new TCM medicine from the experience in fighting the previous pandemic like SARS. We had introduced 莲花清瘟. and also the 许必定 injections, also for SARS, and for H1N1 2009 influenza pandemic, 金花清感 granule also born amid the pandemic that also involved academician Huang Luqi and other academicians. So which means the curative effect of TCM, also the role of TCM to deal with pandemic. So this year we encountered the enemy called COVID-19 pandemic, and a traditional medicine with new application. So we found that from a clinical trial, have the effective results showed from the clinics to treat the patient with mild and the normal symptoms. That for the 金花清感 and 莲花清瘟 capsule for 许必定 injection, it will have a good results preventing the excessive coagulation and also inhibits the symptoms, the cytokine storm. And this time we also, on top of the A3 medicines, we have 3 formulas. We have the 清肺排毒, the 化湿百毒 formula, as well as 宣肺败毒 formula. So these 3 actually help us to treat the patients based on the diagnosis of syndromes and diseases, and also the heritage of the tradition, and for more innovation. So my questions regarding the food therapy, what kind of food help people to improve their immune system to fight against COVID-19 virus? Thank you for your question. Based on my understanding, TCM in Malaysia actually quite welcomed and also familiar with TCM. In order to answer your questions, I would like to talk with the message from the inner canon of internal medicine. So TCM emphasizes a lot on the precaution. So we talk about this time, this also played a key role, and we emphasize many times in the makeshift hospitals based on the requirement of the Hubei Health Commission. We give a formula regarding the precaution, so no medics were infected. And also we talk about another message from the inner canon of internal medicine. Emphasize that we should improve the positive Qi in the body, so the healthy Qi storm in, the evil kept away. That is why you can see 八段锦 and other exercise from TCM also practiced in makeshift hospital. We talk about the food and medicine, and also from the same origin. That is also why you look at the therapy. We also give some a food that can help to improve their immune system and self-healing. We talk about staying home for quarantine as an effective way. That is why we need to do some disinfections at home. The same for your body. And we talk about how to improve your healthy Qi in your body amid the outbreak of pandemic. So you need to stick to a healthier routine of your life. So make sure that no evil can impact and dampen your body. China News Agency. And we have seen a decreasing number of patients in hospital. Also some fewer patients with severe and critical patients, and how TCM can play its role to treat these group of severe cases. Thank you for your question. This is actually a very meaningful and important topic. The treatment of critical cases is a very important step to further reduce the mortality rate and improve the cure rate. Based on the previous 2 months of clinical treatment, Also a physician with the background of SEU and the CCM, and also really study this area, this front, from a TCM perspective, and had a lot of discussion with my neighbor and also the Dr. Du. So talk about the integrated therapy actually help us to gain a rich experience based on our 2 months practice. The National Health Commission also organized the expert group of integrated therapy, so that created a good way to conduct a collaboration. We talk about the ventilator, ECMO, the dialysis medicine, the equipment from Western medicine actually are the key and fundamental method to treat critical cases. But TCM actually for us, we use like Dahuang, this medicine can help the less use of the painkiller, and we also to apply the formulas and also the decoctions to treat the patients with the improve the blood saturation, and also have a good result in inhibiting the cytokine storm. And we also together work on the use of ECMO, the dialysis or the CRRT, and also when it's the best time to use a ventilator, and also the incubation. And for TCM, we focus on how to better support the life-supporting medicine, and also to leverage the advantage of both sides in order to lower the mortality rate. All these experience actually help us to see a good result, and also the replaceable role played by TCM. Right now, when the whole world is dealing with COVID-19, I believe this is a valuable experience to share with other countries, to roll out in other countries, to further lower the fatality rate, to cure the patient. Thank you. One last question. Bloomberg, which country has received suggestions given by China, and have they used a TCM? What's the result? Thank you for your interest in international collaboration. The public emergency is a common enemy facing every country. Working together is the way out. Since the outbreak of the epidemic, many countries and the people gave the selfless donation and care and support to us. They always fight on China, fighting on Wuhan. It also helps us to increase and improve our confidence and courage. Right now, the COVID-19 has already become a pandemic. We also would like to give our support within our capability to country needed. We have already conducted work in the following areas. First, we shared our experience with other countries and swiftly worked with WHO regarding the role played by TCM in diagnosis and treatment, and also released a most updated diagnosis and treatment protocol in English and published on the website, as well as shared with other countries. So you can always find all these protocols and treatment plans on our website. We talk about more hundreds of thousands of patients actually pulled together for centralized treatment, and the curative effects were confirmed based on the clinical results. We also conducted telecommunication with Japan, ROK, Italy, United States, Iran, Singapore, to share our experience. Academist Professor Zhang, Professor Wang, Professor Liu, and Professor Chu, I believe, all involved many times in the telecommunication, right? To share the experience with the United States. And yesterday, academician Tong Xiaolin also conducted a telemedicine to conduct a consultation on the A1 patients in Iran. And the second, we also donated the TCM, the departments and the companies to Italy and France, and also the Hong Kong ICR, Macau ICR. They donated the needles, the prescriptions, decoctions. Zhang Boli, Mr. Huang Luqi all had introduced information in this regard. And third, we also organized a group of experts to give our support overseas. Have the experts TCM to Italy and Cambodia. According to my knowledge, TCM experts is always keeping a close communication with their colleagues overseas, and so far we have seen a good progress in this regard. TCM is a great results that we gained from our experience in treating the respiratory treatment, and we always would like to cure the illness that is still obscure, and also would like to share the experience. And to Yu, when she got the award of Nobel Prize, saying that TCM is a vast of treasures in China, and also cite the anti-malaria drugs, the artemisinin, is only the one critical result from TCM. TCM always be the powerful gun for us to kill the enemy. I would like to work with other countries to win the battle against COVID-19 and write a bright future together. Thank you. Thank you all the speakers. Today, look at no matter is a government official or the academicians, they are all the heroes in harm's way and have stick to the position for more than 2 months, from winter right now to spring. Academician Zhang, with his age of 70s, also worked really hard. I would like to pay the highest homage to all the academicians. Right now we have seen a good momentum here in Hubei, have seen many zeros in Hubei. We see a strong leadership of General Secretary Xi Jinping and a great support and arduous efforts made by people in the whole country, especially the people in Hubei and Wuhan. We finally see the spring already here around the corner, and we've seen the spring blossoms. It's very promising, and China will for sure have a bright future, and same for Hubei. And that's for today's presser. Thank you.